Sigma Mental Health Urgent Care, what kind of services do they provide?
Yeah, we provide outpatient psychiatric services for people on an immediate basis. So what that means is that people can be seen today. They can come into our clinic and have a diagnosis and leave with an appropriate prescription medication if that's what they need today.
How important is that when somebody comes in? Because often when people finally get to that point where they break down often and they realize, no, I need help. And we've all been in those situations where we've seen it in somebody where they're desperate and they're like, no, now I don't know if I could take another day of this. So just how important is that to be able to see them the day of?
When what was happening, so I was in private practice, seeing outpatients, and we started to have to turn people away because there wasn't time to see them. So the schedule would be full and somebody's calling and they have something that needs a timely intervention. You know that it does. So you have the option at that point to either wait until they need a hospital, let it get bad enough that they go to the hospital, or make them wait for an appointment, possibly weeks. And that was kind of where the idea for the urgent care setting evolved, is that, you know, there are people on the phone. If I had more hands here, if I had a team, we could say yes to these people and we could help them. And so that's what we started to do about 10 years ago.
It's a fascinating concept. Are there more of these?
You know, there are some services that offer walk-ins, but they often kind of slip to where they have trouble maintaining the walk-in model because they're an urgent psychiatric model is not a one and done, like bracing an arm after an injury. It's several months in many cases. And so as more and more people need to stay longer, services can fill up, so it's hard to maintain. There has to be an artful effort to move people through and get them referred to another place, or to expand the number of providers, which can be hard for some clinics to do. So there are some, but they have a hard time maintaining the model a lot of times.
Okay, understood, and I appreciate you walking us through that. So now I want to get to the sort of what's starting all of this, which is mental health, and then there's serious mental health issues, or serious mental illness. There's a difference between the two.
Yeah.
In your experience, what does that look like? What does the difference look like?
Yeah, so it's Mental Health Awareness Month, and we talk about mental health awareness, and that's generally like take care of yourself, exercise, eat well, be healthy. And then there's mental illness, and very often that can include things that are short term. It can be somebody who has a single episode of depression when they go through a divorce or a big life transition, and it resolves and that's all they have. Or they have something that lasts longer, but it's really responsive to medication and it's really straightforward. Serious mental illness are the kind of neurologic psychiatric diseases that are really more severe and impair people, like things like schizophrenia or bipolar disorder in some cases, not all, major depression, the most extreme versions, where people are not able to function, they're not able to work and support themselves. In some cases, they're not able to cooperate with their family, and they can rob people of their former selves and their entire lives. And so that's a whole nother category.
And do you see that being are you seeing many of those cases locally?
Yes, I mean, I think we all are. We all are, yeah.
And what do you think, what are the biggest problems that we're seeing with serious mental illness? As far as, let me be specific, as far as symptoms, are we seeing more people suffer from bipolar disorder, borderline personality disorder? I'm asking this question because I know that with the DSM, a lot of things, it gets updated and a lot of things change. It was only a few years ago that we started hearing more and more about bipolar disorder too.
Right.
Which is different, and sometimes the rubric that's used to diagnose people changes as you basically see more patients, right? I mean, isn't it often reviewed?
Yes, and the DSM is updated, and so I'm glad you brought that up, because what's happened over time is that the criteria for any condition, let's say bipolar disorder, have been expanded, And that expansion helps us catch things earlier, but it expands the definition of the illness. So what happens is people with milder symptoms are encouraged to go and seek treatment. And that's great. But we really don't have enough hands for the expansion that has been brought on by mental health awareness and by the DSM kind of expanding the categories. And what we've really seen with serious mental illness is that some of the people who need the most are not getting the most. The services are hard to access, there are too many people, the wait times are long, and they're waiting too long to get help, which can worsen their illness.
So what do people do? What if families, and what I mean by that is families, usually it's, first of all, this is devastating when you have a loved one that has a serious mental illness, because you want them to get help. But what do they do if they have a child or a parent that has a serious mental health problem here in San Antonio?
Yeah.
Where do they start?
Yeah, I think they start with NAMI. So the National Alliance for Mental Illness is a grassroots organization. It's a support organization where they can go and they can get referral lists, they can get connected to resources, and they can find out what kind of help is available for their need. Maybe they need to get help near their community. Maybe they have trouble with transportation, and so they can look at resources in their area of town. And so I think that's a really good place to start. I think sometimes people don't know where to go, and they wait and they wait, and they do end up at a hospital where they might just get looked at and said, no, you don't need hospital admission for this, and sent home with nothing. Or they might be bad enough that they have a hospital stay, and it's a shame that they waited and had to do that. So we really want people to get outpatient services. And what I've heard some of the folks in the community refer to as pre-crisis help, right? So before it builds all the way to a crisis, you're already intervening to make sure it doesn't get there.
The question is whether we have enough resources, and you just said before, no, especially because of what we're seeing, that people are encouraged to get help if they have a mental health issue, but it is the people with serious mental illness that aren't really getting the care that they need.
Yeah, we don't have enough, for sure. We don't have enough funding, we don't have enough clinic space, we don't have enough clinical providers, we don't have enough. And there are answers that many organizations and leaders are trying to put together. For example, the state of Texas has implemented some programs where primary care doctors can call a 1-800 number and consult with a specialist, a child psychiatrist, for example, or a specialist in perinatal psychiatry if they have a patient who's pregnant and is exhibiting serious signs of illness and needs a medical intervention. So we're implementing and we're trying to catch up to the need, but we're behind. We don't have all that we need.
How do people have hope then when they're watching? I don't want them to walk away from watching this interview and think, okay, well, it's hopeless.
Right.
I need help, but I can't get it.
Yeah, I don't think it's hopeless. I think you have to sort of get your foot in the door. And so if you're experiencing something, if you or your loved one are experiencing serious signs of mental illness, you should get help. One of the first stops would be NAMI. Another stop would be your primary care doctor for a referral. And then there are lots of clinics and outpatient settings and places people go. There are online clinics for people who need that. It's just learning how to navigate what's out there and what's going to meet your family's unique needs.